How often do women experience postpartum depression? Is it possible to cope with it? Today, we will take a closer look at this phenomenon and find answers to these questions. What is postpartum depression? Postpartum depression is a condition in which women experience such intense feelings of sadness, anxiety, or despair that they find it difficult to manage everyday tasks during the postpartum period. Emotional fluctuations are common among mothers in the postpartum period. For some women, this fluctuation diminishes within a few weeks after childbirth, while for others, the emotional ups and downs persist for a longer time. Days after childbirth. What happens to a woman's body? The weeks following after childbirth are challenging for both new parents and their children. This period is called the postpartum period and lasts about 6 weeks or until the mother's body completes its adaptation and returns to a state close to pre-pregnancy. During this time, a woman undergoes both physical and psychological adaptation to the process of childbirth. The postpartum period requires significant changes and adjustments. These changes affect physical, emotional, and psychological well-being. In the first days and weeks after childbirth, a woman's body undergoes numerous physical changes. She may experience a surge of energy or, conversely, feel intense fatigue and depression. Although these changes are normal, fatigue can negatively impact her well-being and confidence in managing the newborn and the new family life. One of the challenges is the loss of sleep faced by the primary caregivers in the postpartum period. According to the 2007 Sleep in America survey, a significant percentage of women reported a lack of sleep both during pregnancy and after childbirth. Sleep deprivation can lead to stress, marital conflicts, and decreased decision-making ability. A recent study found that one or slight improvement in sleep issues from 6 weeks to 7 months postpartum was associated with increased depressive symptoms. After childbirth, a woman's body undergoes sharp and significant hormonal changes. At the time of the placenta delivery, estrogen and progesterone levels drop sharply and remain low until the ovaries resume hormone production. According to statistics, about 70% of new mothers in the USA experience what is known as postpartum blues. Approximately 2 to 3 days after childbirth, they begin to feel depression, anxiety, and irritability. These feelings can come and go over the months following the birth of the child, often peaking on the 3rd to 5th day. Even without treatment, these symptoms usually resolve within 1 to 2 weeks. However, some women develop postpartum depression, which is a severe depressive episode occurring about 4 weeks after childbirth. Women suffering from postpartum depression experience such strong feelings of sadness, anxiety, or despair that they find it difficult to manage daily activities for at least 2 weeks. Without treatment, postpartum depression can worsen and last for many months. Many women with postpartum depression do not seek help. For example, one study showed that 15% of surveyed women had symptoms of postpartum depression, but less than half of them sought medical assistance. It is estimated that 10 to 14% of new mothers suffer from postpartum depression. A review of studies identified the following risk factors for developing postpartum depression: a history of depression, and anxiety during pregnancy, nearsightism, low self-esteem, postpartum blues, marital problems, and low levels of social support. Additionally, one recent study showed that women with a history of depression are 20 times more likely to suffer from postpartum depression compared to those without a history of depression. How is postpartum depression treated? Several antidepressants are effective in treating postpartum depression and are considered safe for breastfeeding mothers. Psychotherapy, especially cognitive therapy, is also effective. Furthermore, regular physical exercise can help in the treatment of postpartum depression. For example, a recent meta-analysis concluded that physical activity in the postpartum period is a safe method for reducing symptoms of postpartum depression. The impact of postpartum depression. A mother's postpartum depression can affect her interaction with her child. A review of studies showed that difficulties in interaction between depressed mothers and their infants occur across different cultures and social groups. These difficulties include reduced maternal sensitivity and low responsiveness in infants. Several aspects of child care are also disrupted, including feeding, especially breastfeeding, sleep routines, and safety practices. In one study, postpartum depression was associated with an increase in accidental injuries among 4-month-old infants. Another study found that maternal postpartum depression, unlike generalized anxiety, was linked to increased emotional negativity and behavioral problems in 2-year-old children. Postpartum adaptation of fathers. Fathers also undergo significant changes during the postpartum period, even if they spend the whole day at work. When a mother develops postpartum depression, many fathers also experience symptoms of depression. Some fathers feel that the child becomes the main priority and that all the mother's attention is focused on the baby, making them feel replaced by the infant. One study showed that 5% of fathers experience symptoms of depression in the first 2 weeks after childbirth. Support and care from fathers can influence the likelihood of postpartum depression in mothers. One study found that the higher support from fathers was associated with the lower rates of postpartum depression in women. A recent study also showed that depressive symptoms in both parents are linked to poorer bonding with the infant in postpartum period. Please take care of your health and remember to support your partner during this challenging time. Parenthood is a shared journey, and harmony in the family develops on everyone's contribution. You made a joint decision to become parents, so it's important to move forward together, helping and supporting each other. Thank you for watching. Please subscribe to the channel and leave thumbs up. Bye.